Hey y'all, it's Marilu with Nursing in Progress. Today I'm going to be going over Chapter 2, which is the integumentary system. Chapter 3, which is the head, face, and neck. Chapter 4, eyes, ears. And Chapter 13, sensory neurological system. Alright, so let's get it started. I put a few videos in here about the skin so you guys could know that we're really just talking about that. We're also going to just talk about the face, which is the head, eyes, ears, nose, and throat. And of course, as I mentioned, chapter 13 is going to be neurological. So I hope you guys do like the videos in there, and I wanted to make it a little better for you guys. Anyway, let's get it started. First thing you must know is the epidermis, the dermis, and the subcutaneous tissue. How I remember that is the EDS. Epidermis, which is the top layer of the skin, dermis, middle, and then subcu. It's like going inside. So that's how I remember EDS. Remember epidermis, dermis, subcu. And that's just a little thing to know so that when we get to the ulcer part, we kind of don't mess up on that part. Okay, things to know. So when the skin is bluish, we want to know that is cyanosis. When the skin is yellow and the sclera is yellow, that's jaundice. And jaundice is associated with the hepatic dysfunction. Already, so if we are aware of that, there's definitely going to be a picture in the test, I believe. Which there's going to be like a person. It might be different, but there might be like a person in there, like a picture in the test where a person's going to be yellow and their sclera is going to be yellow, and that's definitely going to be jaundice. So if that picture does come up, just know that that's jaundice. And we also need to know like the butterfly rash of lupus. So if we also go in the test and there's a picture in there about somebody with the butterfly rash, we need to know that it's associated with lupus. Already, let's keep moving on. Okay, so another thing that we need to know is hirsutism, which is when facial hair on females, when females get like facial hair like in their face, or they're like very hairy. So that is hirsutism. And another thing to know is a capillary refill. The capillary refill needs to be within the 3 seconds. Anything that's greater than the 2 seconds, they would be technically considered an abnormality already. And then the shape of the nails, we need to be aware that normally 160-degree angle between the nail bed is normal, and the clubbing would be anything over 180 degrees angle. So that's something to be definitely aware of. And so right now I'm just giving you guys facts, and then we're gonna go into more detail, and I'll give you guys a few questions so you guys could answer. Okay, so remember how I told you guys to remember EDS? First is the epidermis, then the dermis, then the subcu, then the muscle, then the bone. So let's talk pressure ulcer stages. First stage to remember, must remember for that first stage, because there's definitely going to be a few questions in the text, in the exam about that. So the stage 1 would definitely be considered non-blanchable. So just look for non-blanchable intact skin, and so just look for that non-blanchable, anything that's non-blanchable, erythema, or intact skin. So that's something that's the keywords to look for stage 2. What you're going to be looking for is partial thickness, epidermis, and dermis. So for stage 1 is non-blanchable. We're still on the epidermis part. And then on the stage 2, remember, we're going into the dermis. Remember how I told you guys to epidermis, dermis, subcu. So we're going into the dermis. That's 2 layers, epidermis and the dermis. So the stage 2 is partial thickness, epidermis, dermis, okay? And now stage 3 is full thickness. That is the subcutaneous tissue. That's the key word to remember. Another thing that might be on the test might be like a deep crater that may undermine adjacent tissue. So stage 1, remember, epidermis, which would be intact, non-blanchable, and potential ulcers. That's always going to be stage 1. Stage 2, there's 2 layers. That's the epidermis and the dermis. That's why it's stage 2. Stage 3, remember we talked about this, sub-Q. So if it says anything, the subcutaneous tissue or anything full thickness, we definitely know that's stage 3. Stage 4 is full thickness loss, and that one's usually going to involve the muscle, the bone, and that is stage 4. So if you're like in the middle of the exam and you forgot and you're like, oh my god, I forgot what stage 1, stage 2, stage 3, stage 4, just remember stage 4 is always going to be bone, muscle, bone, because you're already deep inside. And then deep tissue injury is a pressure related injury that appears as a deep bruise with the intact skin, but that is also going to be related with stage 4. Alrighty, so let's go over a few questions. Chapter 2, integumentary. Primary function of the integumentary system is the first line of defense. And then the second question is, what is a normal assessment finding in a newborn? That is going to be psychological jaundice. What type of question would a nurse ask to a patient who has a mole? The nurse would ask, when did you first notice this? So in regards to the normal assessment for a newborn, generally it would be jaundice. Sometimes when the baby comes out, they do look a little pale or a little yellow, and that's due to the fact that the babies do have jaundice generally as a newborn. Okay, now we're going to be assessing a patient that's a little darker. So the nurse is assessing a patient of dark skin. Which location is most appropriate for the nurse to use? So the nurse would assess the oral mucosa, which is around the mouth, and that's where she would be able to see, if the patient has any type of jaundice or any abnormalities. Another question that might be spotted on the test would be, what is a common assessment finding for an African American? So for African Americans, in regards to skin assessment, we would be aware that they have keloids, Mongolian spots, etc. So that is definitely something to be aware of for this upcoming test. More questions. So, what skin disorder is most likely occurring during childhood? And the question that might say something like varicella, it might not directly say chickenpox, but if you know that varicella is chickenpox, that would probably be the answer for you. A nurse is assessing a patient with a skin condition. Which condition is common in the fall? And that would be hives. And the medical term for hives would be urticaria. All right, let's ask more questions. Where would you assess to determine apocrine gland functioning? So just remember, apocrine glands is the sweat glands, and the first place where a nurse would assess would be the underarms. Other places would be the groin area or around the nipples. Okay, here's the next question. The nurse is assessing a patient and knows jaundice. Which conclusion by the nurse is most appropriate based on this assessment finding? So the patient knows jaundice. The first thing that should definitely come to your mind would be a liver impairment. Sorry. Okay, moving on to the next ones. Lesions, which is a palpable serous filled primary skin lesion that's less than 1 centimeter in size. So the keywords to look for here is serous filled, less than 1 centimeter. Those are the keywords. Serous filled, less than 1 centimeter. And that's vesicle. So the next one would be, the nurse notes a pus-filled primary filled lesion. Which term will the nurse use when documenting this finding? Okay, keyword. Keyword is pus-filled primary. So it doesn't say serous. Remember, on the vesicle it says serous filled. On the pustule it says just pus filled, not serous, which is a vesicle. It's pus filled. So just remember pus filled, pus, and then pustule. The first three letters would be pus, pus filled, pustule. Okay, and then for vesicle, just remember serous filled, serous, vesicle, pustule. Okay, stages with pressure ulcers. Patient has a pressure ulcer, which is a full thickness loss involving subacute tissue. Which stage? All right, so remember subacute, anything that you see stage with the stages subacute, just instantly should come to your mind stage 3, because remember how we were talking about the epidermis, dermis, subacute, so EDS. So when you think of subacute, you're thinking E is the first one, D is the second one, the third one is subacute. So that's stage 3. So next question would be, which pressure ulcer presents with the full thickness loss with extensive involvement of supporting structure? So this one should definitely be stage 4. So stage 3 would be the same as stage 4 with full thickness loss. But remember, stage 4 is extensive involvement of supporting structure. So stage 4, just remember full thickness, extensive involvement, and I did underline supporting structure. Okay, so just remember full thickness, extensive involvement is going to be stage 4. One of these questions is definitely going to be on the test. Moving on to pregnancy and assessment. So the nurse notes that a pregnant patient is experiencing cloasma on her face. For which reason does the change occur during the pregnancy stage or pregnancy? So during pregnancy, the patient that is pregnant is going to have increased estrogen levels, and that's what causes that cloasma on her face. Alrighty, more questions. A bull's eye rash may be indicative of which problem? I think this was like a very common question during pathophysiology. We learned about the bull's eye. So just remember, the bull's eye is the Lyme disease, which is like a tick. When a tick, like bites you, it does something to your body. It's like a bull's eye. That's the thing to know. Okay, moving on. What is the difference between a primary and a secondary lesions? So the difference is a secondary lesion results from a change in a primary lesion. So the difference, of course, is that the secondary lesion results from a change in primary lesions. Okay, moving on. Which is the best location to assess cyanosis for a dark-skinned patient with congestive heart failure? Okay, I think we kind of went over this, but it's good to know it's the buccal mucosa, which is basically buccal mucosa is around the lips, and that's where you would be assessing a dark-skinned patient due to the fact that sometimes you can't really tell because of the skin color. But that's definitely a place to check in regards to darker patients. Okay, so when inspecting the nails for cloving, which is a normal angle of attachment? So for cloving is if it says 160, you definitely know that's normal. If it says 180, that's abnormal. So 160 normal, 180 abnormal. Remember those numbers: 160 normal, 180 abnormal. Okay, moving on to more lesions. Which is a primary skin lesion that's considered a raised macule? So when you think of a raised macule, think of like a pimple, and that would be called a papule. And moving on, which primary lesion is a flat area of color change less than 1 centimeter in size that's often referred to as a freckle? So freckle, macule, just think freckle is like a macule and papule is like a pimple. And those are little words to know. I kind of did underline papule and macule because those are two little things to know. One of them might be on the test, not both, but probably one. So just be aware of those questions.